How are you doing? How are you doing tonight? Well, I just hopped off a webinar and it was empowering new nurses. So I just want to share with you right now some of the things that I talked about. First, let me say Happy Women's Month. Happy Women's Month. Enjoy it. As a woman, you have so much to offer. You have contributed so much to family, church, school, society, everybody. So just take time out and enjoy yourself. It's your time. So, with regards to my young nurses, the seminar, the webinar has been on empowering them. Yes, let them gain some confidence, better, stronger, and be more empowered. So, tonight, I just talk about the power of the mindset. The power of the mindset. The young nurse has to learn to adjust, adopt the growth mindset, because that's the one that's gonna make you move forward in spite of the challenges. You won't feel stuck. Or if you do feel stuck, you're gonna get out of it because you're gonna be resilient, you're gonna be strong, you're gonna move forward. Now, how do you do that? By being intentional, by taking time out and embrace some of those words like I can. Words like effort, resilience, growth, unlimited. So, you know, read those positive things, think on those things that are really great. It was Dr. Joseph Murphy who said that, I'm sorry, who actually talked about depositing in your subconscious the positive things, deposit positive thoughts. And of course, if you what you put in, you will get out. So if you embrace the things that are positive, of course, you're going to be like that. You'll produce positivity. So bear that in mind. Also, overcome self doubt of the imposter syndrome. Not feeling that you're adequate enough or you know enough, or fear that something gonna happen that's not too good or something. You're so brilliant and yet you're doubting yourself. So you got to get out of that mindset and get out of that mindset and think positively because you can do it. The sky is the limit. Stay positive. Stay positive. Thank you. Thank you. Stay positive. As you stay positive, just remember that challenges are just temporary. They're not going to last forever. Challenges are like that. So, some challenges that, thank you, some challenges that, all right, thank you. Some challenges that new nurses face. I faced those challenges when I was younger too. All right, thank you. Have a nice night also. So, when I was a young nurse, I remember experiencing feeling of being overwhelmed. At first you're trying to adjust, you're observing, you're getting your notes, you're getting your patients, but then sometimes the patient ratio might seem so, it's not good enough because you might have too many in your mind, too many patients to one nurse, and that ratio is not going to allow you to give the type of care that you want to give. You're trying, but it's going to put some limitations on that. So, nurses have to prioritize what is most important, the task. You have to manage time. And that, when you're new, can be so challenging. I think that could be in a different group category. You in that way you have to maybe have a little checklist, although because we're using the computer now and you're doing real time. However, there are times when situations arise that you got to jot down something in order to remember that you don't mess up. So that's important. Self doubt. You have to have some confidence in yourself. You have gone to school, you studied, you share with others, you have had preceptors, you have had managers, you have had educators who have been helping you along. So start telling yourself, I know I can do it. And of course, you ask for some guidance. Develop relationship with other nurses, other colleagues who have passed on those areas before you and who have more experience. Take feedback, take feedback with a grain of sand, we would say. Why? Feedback can help you to grow. Don't be so sensitive that you think you know it all, or don't put on yourself the pressure that you know everything. Take the feedback and learn from the experience. That's what growth mindset is all about. You just don't question things and take know it all. Nobody knows it all. Or don't put yourself in the background that and don't ask questions. It's best you ask questions and get it clarification, clarify some clarity there, and then because we always say it's better to be safe than to be sorry. So get clarification and not guessing. And that will put your patient at a safer place and you yourself be out of trouble. Okay? So, balancing work life. What does that look like? Okay, you're new. You're transitioning from a student or to a nurse, or you were a PCT or a PCA or a CNA or a HHA, you were before. Now you have become a nurse, a registered nurse. And guess what? Different tasks, different responsibilities. So never think that because you have become a registered nurse, you cannot hand a bedpan. There are different roles, there are different description for your work. However, if you are a registered nurse, thank you so much. If you're a registered nurse and you're at a spot where you have to give a bedpan, the patient asks for it. Now, you should have to leave what you're doing and go, if you're in that same vicinity, and go look for a PC or somebody out there to do it. Now, you're a nurse. The caring, the nurturing, the answering to the call of nursing. Basically, before we were so scientific and technologically inclined, we used to be doing nursing. However, we know we have grown and we have come far. But the basic thing of nursing still remains nursing. It doesn't take anything from you, it helps you because you're putting into practice some of the things that you were taught, basically. So let me encourage my nurses. I've been there for more than 4 decades, so I know, not as privileged as some of you are right now. We are certain things that you don't even have to do. We used to have to do everything. So I am just saying to you that I appreciate you and I don't want you to forget your nursing and the basic things, caring for humanity. And building your clinical skills. So when I said balance, let me jump back to that. When I say balance, I'm thinking that your home, caring at home, caring for the patient, making sure that home is taken care of and patient cared of. In the first part of it, it's gonna be challenging. I'm not gonna fool you that. The first part is gonna be challenging. When you're just starting, it's gonna seem overwhelming. You have to get this done at home, and if you have a family, blah 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 blah. You know what that looks like. But you have to take time out for yourself. You have to take time out for self-care, or else you will be burnt out because you want to be there's some amount of anxiety gonna be coming on. You want to make sure you do everything right. You're gonna make sure you have the answers, the best answers for your patient's family. It's not just for the doctor or the other nurse, but the family members are gonna come and they'll be asking questions, and you're gonna try to make sure that you research your patient, the diagnosis, and be able to relate and be able to have something to tell them. Because if you don't have something to tell them when they're asking And some of them can be demanding. You know that by now. But it's our approach and our responses to them. So we have to take care at home, self care, take your little exercise, plan time for yourself as you plan to do something else or some of your chores. Make that a part of you, of your program too, of your plans. Building clinical skills and be confident. Now let's look at that. At first, to insert an IV might be challenging. What are you going to do? You're going to make sure you go to the lab. It doesn't have to be the work time. You might use some of your break depending on what that looks like. But you can take your extra time. You can, if you're not busy, you can ask your manager or ask whoever it is in charge. Remember, I said ask and get some time. You can also ask the educator if you need more time to practice. Ask the simulation lab person, the director or whoever works in the lab, if you can practice. I used to do that when my nurses, let them get some experience. If they're not too comfortable, give them the mannequin. They come down X time, go through the mannequin and remind them or reinforce some of the techniques. All right. So that's important, but you have to initiate. You can't just depend on everybody else. You have to initiate. So remember, it goes two ways, this way, that way. You have to show some interest, and your preceptor sees that and show. Don't hide. You know, there's sometimes nurses see that another nurse doing a procedure or is in a bind. And instead of going and try to help and learn, so that when their time comes, they will have the resource within them and the resources from their experiences that they got to help them to function, to be more efficient. But if they hide away from the work, hide away from learning, then it's going to be more difficult and more challenging for them. Encouraging you art, and again I say happy Women's Month, and I just hopped off that that webinar, and I have, so you have to go on YouTube, and I'm going to set that up tonight because I actually did it, and you will see what's on it that can help you along the way. I encourage you to get my book because a lot of tidbits in there if you haven't got your book yet. Seller, and it's Nurse, the guide to empowering new nurses in the delivery of high quality care to all patients. And it's from the heart, and it is, I'm happy I did it. I'm happy I wrote it because I've got some feedback that are positive, you know. So thanks for subscribing, and let me hope that you can get your book on Amazon and all patients. I'll be setting up some webinars, more to come. I hope to have another one in this month, but I haven't decided the date. But I'll endeavor to do some lives and introduce you to my podcast. It's under Empowering New Nurses. That's my podcast. So why do you drive? And Instagram, of course, is Podcast Mir. Okay. And of course, you're watching on YouTube, which is Miriam Amanda Smith. Thank you so much for listening, and keep your nursing going. I appreciate you. And just remember, pioneers have passed, and they have handed us. They have passed it forward. They have paid it forward for us, and so we in turn have to pay it forward for others. Thank you so much for listening. Have a good night. Get some good rest. Bye bye.